From today, workers from overseas can apply for positions in the UK care sector. Well, the crippling number of vacancies and departures mean the government's added care workers to the shortage occupation list. In North East Lincolnshire, they've got a big shortage of staff with 120 vacancies at the moment. Home from Home supports adults with learning disabilities and complex needs such as autism, and one of their 11 homes is in Stanningborough, near to Grimsby. Their managing director joins us now, Paul de Savary. Paul, hello, good afternoon.
Yes, good afternoon to you, Andy.
How are things on the ground with you at the minute? What's it looking like?
Well, it's looking a little bit better than it was pre-Christmas, mainly because we've taken preemptive action and we have increased what we have been paying staff. We've increased our overall expenditure on staff by 19% because it was really pretty desperate before Christmas, as we were losing a lot of staff to other sectors, not within care, but hospitality and so on. So we had to do a sort of correction, a fairly major correction, to stop that happening.
And what would help you now? I mean, this idea now that you could people can come from overseas and so on. Is that going to help? Is that the answer?
I don't think there's any single answer. I think it's that the market has fundamentally changed for people who are working, for workers, and they can. It's got to become much more niche. So we are looking at overseas workers, but again, that does take a lot of time. So I don't think it's any one solution. I think we fundamentally changed our model where we say, actually, this needs to work for staff as much as it works for us. So we're sort of creating packages. For example, in Lincolnshire itself, we've created a package for students. And students, if they do a sort of minimum of 3 shifts a week, 22 and a half hours, we will then pay them after 3 months an additional £300 towards their fees, their student fees, and so that's £1,200 a year. So we're going very much after different niches. For example, also ex-people coming out of the forces, school leavers, and so on. You know, we've got to be very creative and just accept things have changed very fundamentally.
Now, I know you believe strongly this is a career, not just a job. So as a whole sector, is it about improving the image of the sector as well for people?
I think that's obviously fundamental. I think we probably have an advantage because we have invested massively over the last 12 years into our technology and way of doing things. So we have something like 90 different jobs or 90 different roles within our organization, probably compared to maybe 10 or 15 within an ordinary care operation. So I think care has to fundamentally change. It has to adapt. It has to use technology. It has to reorganize itself as a result of the technology. And it has to basically value people in a different way. Not everybody wants to necessarily progress through into perhaps being a support worker, into being a resource manager, or perhaps even being a data analyst. But, you know, that is the sort of environment that we've created. And I would really recommend other providers to start thinking in very creative ways, because I don't think it's really going to get easier over the next years.
Very interesting. Thank you for your time, Paul. Thank you, Paul de Savary there, who is the Managing Director of Home from Home. They have a home in Stanningborough near Grimsby.